Welcome back to Medical Monday. Tonight we're talking with Dr. Melissa Wacko from the Women's Medical Associates of Nashville. Thank you for being here with us.
Yes, thank you for having me.
Dr. Wacko is an OB/GYN, so she's here to answer your calls about pregnancy, about childbirth. Any questions you might have, we're taking them tonight. 615-737-PLUS is the number to call. Let's talk about exercise when you're pregnant. What should you do? Anything that you should avoid?
Yeah, sure. I get a lot of questions about this from my patients, and if a patient comes in to me and they are a marathon runner, they work out every single day prior to the pregnancy, they say that they do a 1 to 2 hour workout every day. I tell them to continue it. Anything that you've done prior to the pregnancy that your body is used to doing, you can do it. With some exceptions. Now, if you are a professional scuba diver, obviously, you can't do that while you're pregnant.
Right.
But other patients, you know, they get very nervous about gaining weight, and they say, can I start working out? Can I start this new routine? I always recommend against that. So you don't want to start an exercise that your body is not used to during pregnancy, but to continue something that you know you're conditioned to do, that you've been doing for several months prior to the pregnancy, is perfectly fine.
And is it safe to say it's always smart, if you are a habitual exerciser, you got to listen to your body, because at some point you're carrying a lot of extra weight, you're carrying another human being, and you're going to kind of have to slow down.
Exactly, and that's what I tell patients. I say, just, you know, kind of pay attention to the signs. If you're doing your normal routine and you're very, very out of breath and you're having cramping or you're having contractions, then stop and rest, or, you know, tone it back a bit. And, you know, the best thing that you can do during pregnancy is to just kind of be aware of what your body's telling you.
And it's going to be telling you a lot, right?
Right, yeah, and women have a good intuition. So, you know, when I tell patients, if, you know, even during pregnancy, if you feel like something's not right, you feel like something is wrong, by all means, please, you know, call the office, come in and see me, because oftentimes, you know, that intuition's correct.
Really. Let's talk about travel, especially with baby moons. They're so popular now. That wasn't a thing when I was pregnant. I wish it was. But a lot of folks still want to travel. They want to get in those last vacations. Yes,
baby moons, that can be a hot topic in the because women look forward to it, and they've been planning it. I recommend to patients, don't go out of the country on your baby moon. By all means, go to the beach.
Sure.
You know, have a good time, but I would recommend staying in the country. And as that goes, I do recommend, you know, Zika is still a thing. It's not it's not on the news.
Right, it's not. We haven't talked about it in a while.
But if you were planning a vacation early in the pregnancy, you're planning on going somewhere with your family, go to the CDC website. CDC has recommendations as far as which countries Zika is still a thing, and, you know, and recommendations on how long you should avoid pregnancy if you go to one of those countries, and what you should do if you've gone to one of those countries while you're pregnant.
Beyond vacationing, some women travel a lot for their jobs. When is it not safe to fly anymore? What should women pay attention to as they travel and are pregnant?
There's no cutoff, really. There are some airlines that will be hesitant to let you on because they're worried you're going to go into labor and they're going to have to land the plane early. But there's no real, you know, cutoff as far as OB/GYNs are concerned. I tell my patients, if you're full term, if you're 38 weeks pregnant and you're going to go into labor at any point, don't get on the plane. Yeah. Okay, because even if you're traveling within the United States, you might be delivering in a hospital where they know nothing about you, your doctor doesn't know anything about you, they don't have your records, you're not with your family. So I definitely recommend traveling once you're full term. I tell my patients after 35 weeks, I wouldn't travel too far.
Let's talk about some common myths, and oh boy, there's probably a book full of myths when it comes to pregnancy. What are some that pop up with your patients in your office? You have to say, no, that's not really true, or yes, there is truth to that one. Sure.
So I think that probably the most common myth that I get asked about in my office is the prediction of the sex. So everybody wants to know very, very early, is it a boy or a girl? And a lot of people think that common myth, if you have a lot of heartburn, that it's a boy. and that's not true. You can have a lot of heartburn for various different reasons. I also hear if you have a lot of heartburn, then the baby has a lot of hair.
Yes, I've heard that one before.
There actually is a very small study that just came out that shows that there might be some truth to that.
Really?
But that study, it's a very small study and it's only one. So I think that's probably not true either, but
yet to be determined, perhaps.
We'll see if that plays out.
Some other ones that you've heard, what you're telling me about putting your arms above your head?
Yes, that's one that I've heard. That seems to be in certain populations of patients that their grandmothers have told them if they put their arms over their head, that the baby's cord could get tangled around the neck. Also, definitely not true. I mean, obviously, we have patients who do
lots of things with their arms over their heads.
Like I said, you can do any of the exercises you were previously doing. So if patients were lifting weights before, then they can do that, and it has nothing to do with the cord around the baby's neck.
As we talk about common myths and reading and apps and everything else, I'm sure people come in and have all kinds of different books. They say, I've read this in this book, or this book told me this, because there is a plethora of books on the subject of having babies. What are some books or some apps that you like?
So there's a couple of books that I read in my own pregnancy that I really love, and you know, the standard one, this isn't a promotion for them, but what to expect when you're expecting. You know, there's some controversy about some of the things in there, but I tell patients, you know, it's a pretty standard reference, and a good reference for a lot of the common questions, and you know, what to eat during pregnancy, what to pack for the hospital, that sort of thing. And you know, there's a lot of websites. You know, I think What to Expect When You're Expecting has a website as well, and that's always a good reference.
Okay.
And your OB is probably your best reference.
That's a good point.
Yes.
That's a very good point. Let's talk about the gender. Things have changed even since I had my little boys, and my oldest is only 4, about to turn 5. But people can find out the gender pretty early.
Yes, there are blood tests that you can find out the gender as early as 10 to 11 weeks. That blood test is not specifically for finding out the sex, although a lot of patients
do that.
Request that.
What is it for?
So that blood test is actually to test for certain genetic defects.
Gotcha. What would it show? So
it shows, that's recommended for women that are advanced maternal age, which is an unfortunate title because that's just 35 years old and plus, and it shows for various different genetic defects such as Down syndrome.
Okay. So you could find out
different trisomies.
But it's also, you can find out the sex. Is it pretty accurate for the gender?
Yes, it's very accurate.
Okay. Interesting. And then the other way, the old-fashioned way, I guess, is the ultrasound, right?
Right.
And that's performed at what?
So your ultrasound generally is performed at around 20 weeks at your anatomy scan. So for patients, a lot of times they're like, 20 weeks, what is that? That's about 5 months. So at your anatomy scan, they'll do a full anatomy scan of the baby, meaning they'll look at the brain, they'll look at the heart, make sure everything is developing, and then they'll also look and see what the sex is.
What little tidbits are down there, and you get to find out.
Exactly.
Just kind of off the cuff, how many people actually want to know and how many people don't? Do you kind of have like a percentage?
Well, I don't know an exact percentage, although I will say there is a trend now that patients are wanting, a lot more patients I have found don't want to know the sex.
Really?
And usually that's with the second baby.
Yeah.
And so that is the trend now, and that's always fun in the delivery room too, to announce that to the parents, because they always, you know, they're always positive that it's a girl, and then it's a boy, and then it's very exciting.
Do you ask your patients who don't know, like, what do you think it is?
Oh, and then... of course. And I tell them, you know, when I'm doing your ultrasound, if I refer to the baby as a boy or a girl, it's not because it's just, I'm just giving him a pronoun.
There you go. You're just giving him a pronoun and a personality. There you have it. Let's talk about the different controversies that come up, because there's a lot of push and pull when it comes to pregnancy. One would be C-section versus vaginal birth. Where do things stand right now with C-section rates and what you're telling patients about C-sections? So I tell all of my patients, you know, I have a lot of patients that come in and they say, I'm really worried, you know, I chose you to be my doctor, and I really, really don't want a C-section. I tell all my patients, I don't want you to have a C-section either. I don't want anyone to have a C-section that is not medically necessary. So, you know,
And I ask patients, you know, you have to trust me as your doctor that I will try to do everything for you and your baby to get you that vaginal delivery, because that's better for you and better for baby. And you know, if it comes, you know, medical problems come up, an issue with the baby comes up during labor, you have to trust me that, you know, if I decide to do the C-section, that's what's best. Exactly.
When you do have to move to that decision of the C-section, what moves you there? What kind of things happen?
Sure, there are a lot of things that can happen in labor. Labor is, you know, there's no way to predict, really. I mean, even as an experienced OBGYN, some of the most experienced OBGYNs that I worked with in New York, there's no way to predict. You know, we're all certain, you know, we're concerned about the baby's heart tracing. So during labor, we watch the baby's heart tracing continuously. And there are certain factors of that baby's heart tracing that if they become concerning, that can lead us to a C-section, okay? Because that can tell us that the baby is in distress. Okay, and there's only a certain point that we would want to watch that baby being in distress until we decide to do a C-section. Other issues could be that the mother's just not dilating. You know, we've done everything that we could, every intervention, you know, medication, time, etc., and the mother's not dilating. And that would be called, you know, an arrest of dilation. That would be an indication for a C-section. Occasionally, a mother will have had, you know, a certain surgery, a major surgery on the abdomen, or a medical problem that would necessitate a C-section before labor. Sure. And that would be addressed, you know, on an individual basis.
Yeah. Okay. On that note, we're going to take a quick break again. If you have a question that deals with baby making, baby having, now is your time to call. 615-737-PLUS is the number to call. We're coming right back. Stay with us.